More than a decade ago, electronic medical records were all the rage, promising to transform health care and help guide clinical decisions and public health response. With the arrival of COVID-19, researchers quickly realized that electronic medical records (EMRs) had not lived up to their full potential, largely due to widespread decentralization of records and clinical systems that cannot talk to one another. Now, in an effort to circumvent these impediments, an international group of researchers has successfully created a centralized medical records repository that, in addition to rapid data collection, can perform data analysis and visualization. The platform, described August 19 in Nature Digital Medicine, contains data from 96 hospitals in 5 countries and has yielded intriguing, albeit preliminary, clinical clues about how the disease presents, evolves and affects different organ systems across different categories of patients' COVID-19. For now, the platform represents more of a proof of concept than a fully evolved tool, the research team cautions, adding that the initial observations enabled by the data raise more questions than they answer. However, as data collection grows and more institutions begin to contribute such information, the utility of the platform will evolve accordingly, the team said. COVID-19 caught the world off guard and has exposed important deficiencies in our ability to use electronic medical records to glean telltale insights that could inform response during a shape-shifting pandemic, said Isaac Cohane, senior author on the research and chair of the Department of Biome. The new platform we have created shows that we can, in fact, overcome some of these challenges and rapidly collect critical data that can help us confront the disease at the bedside and beyond. In its report, the Harvard Medical School-led multi-institutional research team provides insights from. The data came from 96 hospitals in the United States, France, Italy, Germany and Singapore, as part of the 4CE Consortium, an international research repository of electronic medical records used to inform studies of the COVID-19 pandemic. Our work demonstrates that hospital systems can organize quickly to collaborate across borders, languages and different coding systems, said study first author Gabriel Bratt, HMS Assistant Professor of Surgery at Beth Israel Deaconess Medical Center and a member of the Department of Biomedical in. I hope that our ongoing efforts to generate insights about COVID-19 and improve treatment will encourage others from around the world to join in and share data. The new platform underscores the value of such agile analytics in the rapid generation of knowledge, particularly during a pandemic time. The bar for this work needs to be set high, but we must also be able to move quickly. Examples such as the 4CE Collaborative show that both can be achieved, writes Harlan Krumholtz, senior author on the accompanying editorial and professor of medicine and cardiology and director of the Center for Outcomes Research and Evaluation at Yale New Haven Hospital. What kind of intel can EMRs provide? In a pandemic, particularly one involving a new pathogen, rapid assessment of clinical records can provide information not only about the rate of new infections and the prevalence of disease, but also about key clinical features that can portend good or bad outcomes, disease severity and the need. These data can also yield clues about differences in disease course across various demographic groups and indicative fluctuations in biomarkers associated with the function of the heart, kidney, liver, immune system and more. Such insights are especially critical in the early weeks and months after a novel disease emerges and public health experts, physicians and policymakers are flying blind. Such data could prove critical later. Indicative patterns can tell researchers how to design clinical trials to better understand the underlying drivers that influence observed outcomes. For example, if records are showing consistent changes in the footprints of a protein that heralds aberrant blood clotting, the researchers can choose to focus their monitoring, treatments on organ systems whose dysfunction is associated with these abnormalities or focus on organs that could be DAR. The analysis of the data collected in March demonstrates that it is possible to quickly create a clinical sketch of the disease that can later be filled in as more granular details emerge, the researchers said. In the current study, researchers tracked the following data: total number of COVID-19 patients, number of intensive care unit admissions and discharges, 7-day average of new cases per 100,000 people by country, daily death toll, demographic breakdown of patients, laboratory tests to assess cardia. At initial presentation to the hospital, patients showed remarkable consistency in lab tests measuring cardiac, immune, blood clotting and kidney and liver function. On day 1 of admission, most patients had relatively moderate disease as measured by lab tests, with initial tests showing moderate abnormalities but no indication of organ failure. Levels of the liver enzyme bilirubin, which indicate liver function, were initially normal across hospitals but worsened among persistently hospitalized patients, a finding suggesting that most patients did not have liver impairment on initial presentation. Creatinine levels, which measure how well the kidneys are filtering waste, showed wide variations across hospitals, a finding that may reflect cross-country variations in testing, in the use of fluids to manage kidney function, or differences in timing of patient presentation at various stages. On average, white blood cell counts, a measure of immune response, were within normal ranges for most patients but showed elevations among those who had severe disease and remained hospitalized longer. Even though the findings of the report are observations and cannot be used to draw conclusions, the trends they point to could provide a foundation for more focused and in-depth studies that get to the root of these observations, the team said. It's clear that amid an emerging pathogen, uncertainty far outstrips knowledge, Cohane said. Our efforts establish a framework to monitor the trajectory of COVID-19 across different categories of patients and help us understand response to different clinical interventions. Co-investigators included Griffin Weber, Nils Gellenborg, Paul A. Villick, Nathan Palmer, Luca Chiovato, James Cimino. Please support my channel to grow by pressing subscribe button and the bell icon. We will notify you new tech videos. Thank you.